Doctor, thank you so much for joining us. We welcome you here to Health Connection. Our topic is urinary incontinence in men and women. What are our options? So we like to start off these segments when we do them with a definition. What is urinary incontinence?
Well, to you and me, it's loss of urinary control. Involuntary loss of urine, unexpected loss of urine, lack of control of your urination.
There are different types of urinary incontinence, are there? And what are the possible causes?
So generally we would say the causes, we would separate them between men and women. But generally there's stress incontinence, there's urge incontinence, there's a category called mixed incontinence, which is a combination of stress and urge. There's overflow incontinence, and there's functional incontinence.
Well, let's define all of those.
Okay. So stress incontinence is not stress like we feel with our jobs or with finances. Stress incontinence is physical stress that causes pressure on the bladder and leads to leakage of urine.
For example, you pick something up that's heavy, or you exert yourself in some way.
Right. You cough, you sneeze, you lift something heavy, and you lose control of urine. So it's physical stress like those things you mentioned.
Okay.
Urge incontinence is just that. You get the urge to urinate, your bladder contracts, and you leak urine. Okay. Mixed incontinence is both of those. Overflow incontinence is your bladder so full that it starts leaking. If you envision a cup of water under a faucet and the faucet keeps going, at some point the water rises and it just starts overflowing, and that's overflow incontinence. That would be much more common in men because of our anatomy. There are some anatomic differences between men and women. And then functional incontinence is incontinence where your urinary tract is functional, used simply for other reasons, typically severe debility. I can't get up and go to the bathroom, and you leak urine. And that's a functional problem, usually from some other serious problem, health problem.
So all of these various forms of incontinence, what causes each of them?
Well, they're very different, and they're different in men and women. Overflow incontinence in men is typically caused from outflow obstruction. We have prostates. As the prostate grows, or if there's scar tissue, or there's some physical blockage of urine, that leads to overflow incontinence. Stress incontinence in women is typically due to a lack of muscular support in the outflow tract. That can be caused by bearing children, multiple pregnancies, pelvic surgery, and in postmenopausal women, the relative lack of estrogen causes those muscles to be weaker. Okay. Mm-hmm. Urge incontinence usually is from abnormal nerve supply or abnormal muscles of the bladder that cause the bladder to quiver or contract involuntarily. There are certain health problems that can do that as well. Diabetes can affect your bladder, just like it can affect your eyes or the nerves in your legs. It can affect the nerves and muscles in your bladder. Nerve or neurologic problems can do that as well.
You touched on this, urinary incontinence, more common in women than men?
Typically because women bear children, it's much more common as far as stress incontinence. Now, men can have stress incontinence, say after surgery or things like that, but statistically, stress and urge incontinence are much more common in women. In men, overflow incontinence is more common.
You touched on this, but what's the linkage? Childbearing.
Childbearing is probably the number one thing that we as physicians link to it. Not every woman who has children leaks urine, but a pregnant uterus certainly affects the muscles in the pelvis. Childbearing, delivery, hysterectomy, prior pelvic surgery, all those things affect the muscles in the female pelvis.
One of the things that seems to at least greatly increase the urge to urinate is consumption of caffeine. What's the connection?
Well, as a diuretic, I think that's a common complaint. And when we say what's reasonable, what's a reasonable amount of caffeine consumption? 2 or 3 cups of coffee a day. Almost anyone who drinks coffee will notice that they go to the bathroom more. And so it'll increase your urine production and perhaps affect the nerves in the bladder.
Is that what causes the urgency to seem so much greater?
Absolutely, absolutely. And so, most people, if they cut one thing out of their diet and they notice that a symptom changes, then it's empiric that it's related to their symptoms. And so we ask them, to cut out not only coffee or tea, but caffeine containing liquids or drinks, or even foods like coffee, foods like chocolate that may have caffeine in it as well.
To some degree or another, does urinary incontinence occur as we age, or is it preventable?
Well, it's more common as we age, certainly. I don't know that I would ever call it normal, but it's more likely. It is preventable. I think in women, Kegel exercises to strengthen the pelvic floor, general health, if you're diabetic, controlling your diabetes. Certainly we see more incontinence as obesity rates go up. And so, taking care of your weight and exercise can help those things as well.
Well, let's start getting into treatment. We've now done a good job of defining the problem. Let's start fixing the problem. Effective treatments now available for women. What are they?
Well, typically with treatment, after an evaluation, we start conservative and then move towards aggressive depending on the quality of life. So if we were going to say very conservatively, we say do behavioral things that will help. Limit your caffeine, do Kegel exercises, take care of your general health. If none of those things work, then we, after an evaluation, may try an oral medication to cut down leakage.
Which treatments do you find effective for men?
Well, for men, we really rule out obstruction first. And so if a man is not obstructed, then typically we focus more on medications to control an overactive bladder. If that doesn't work, there are other things that we can do. If they've had prior surgery on their prostate, there are agents that we can inject to cut down the leakage of urine. If none of those things work, sometimes we'll even use Botox, not cosmetically, but in the bladder to cut down on bladder contractions or things like that.
You mentioned getting more aggressive. Surgical options for men and women.
Well, for women, certainly if they have stress incontinence and they fail conservative treatment, there are multiple types of sling operations that either use synthetic mesh, which certainly has been in the press a lot about whether or not it's safe, and it is, it's FDA approved, but non-artificial materials to increase the support that will stop stress incontinence. Now, there's surgery for urge incontinence as well. If medications don't work, Botox in the bladder or nerve stimulators to cut down on urge incontinence as well.
We see this in the culture on television, products advertised on the market claiming to help with urinary incontinence. Truth to those claims?
Well, I'm a born skeptic. Most over-the-counter medicines or non-prescription medicines or products aren't really beneficial. Certainly, I would take them in and ask your doctor about them. But really, we don't know of anything over-the-counter that will really help that much.
Someone is having symptoms of any of these forms of urinary incontinence. What's the next step?
Well, talk to your doctor. If it's a referral to a urologist, certainly get a general health checkup, but go to your doctor. There are a lot of things that we can fix easily that can help incontinence, but an evaluation, I think, is the way to go.
Very well, doctor. Thank you very much.
Absolutely.